Hello, I'm Dr. Robert Shapiro from Shapiro Holistic Health and Chiropractic in Stockton, California. And today I wanted to discuss with you the topic of MedPay. What is MedPay? Well, all of you know what automobile insurance is, so let's discuss the details of that and then break it down and move into the MedPay. In automobile insurance, in the world of automobile insurance, as you know, everybody in California is required to have the basic minimum of what we call liability insurance. Liability insurance covers the occupants of other vehicles if we happen to cause a traffic accident with those individuals. There's two aspects to liability insurance. One of those aspects is property damage, to pay for the damage to their vehicle. The other aspect is bodily injury. That's to pay for injuries that they sustain from the auto collision. Now, there's the other side to automobile insurance, which is called full coverage. And so with full coverage, you get the additional collision coverage, which covers you for any collision that you're involved in, covers your vehicle. A lot of times there's a deductible involved, but the nice thing about that is it will cover the damages to your vehicle and repair it. Nice thing about that situation is if you happen to be in an incident where you lose control of your vehicle, let's say it's a rainy day, you spin out and you happen to hit the rail on the side of the freeway. That's a collision. You didn't collide with anybody, you collided with an object, at which point your vehicle is going to need repairs. The collision portion of your policy will take care of that. There's another part of full coverage called comprehensive, and this part takes care of things like vandalism. If somebody vandalizes your vehicle, breaks into it, breaks the window, and even to an extent, if like a rock hits your vehicle, it will actually take care of that, believe it or not. Now, the portion that most people seem to not carry on their automobile insurance, and it's really unfortunate because it's very advantageous to have this portion on your policy, it's called MedPay. And what MedPay is that if you happen to get injured while you're in your vehicle, typically this happens in the incident of a motor vehicle collision, MedPay will kick in and you can use it to pursue treatment. Now, if you have group health insurance, some kind of medical insurance, many times that might cover you, but believe it or not, it's becoming more common for insurers to deny payment of treatment for injuries sustained from an auto collision. And I'll bet you didn't know that. So this is a situation where it's important to have MedPay on your automobile policy. The other reason you would want to have MedPay on your policy is, let's say that you need treatment from a very particular doctor and they don't happen to be in the panel of your medical insurance. You can take your MedPay to that physician's office and they can bill it and they will treat you. And so that's a very nice reason to have that. I myself have MedPay because I want to be sure that no matter who's in my vehicle, that their injuries are taken care of. Because it's very common, unfortunately, for people to run around without medical insurance. So if they're in your vehicle and they get injured, they have no medical insurance. Now they have to suffer with their injuries. If you have MedPay, it will take care of them. And the beautiful thing is, it doesn't affect you. It won't raise your premiums, despite what most people tend to think. Because when patients come into our office, oftentimes when we ask them to file a claim against their MedPay, they're afraid to. They think, my premiums will go up. I'm going after my own insurance. You're not going after your own insurance. It's your benefit. It's your right to file that claim and use that benefit. That's why you pay for it. So by all means, you would want to file that claim and allow the occupants of your vehicle to seek treatment, appropriate treatment. I want to thank you for stopping by to check out our videos. Please look at our other videos and contact us if you have any further questions. Thank you.